Welcome to this explainer. Look, if you're joining me today, chances are you, or maybe someone you really care about, is right in the thick of navigating the physical and, let's be honest, emotional recovery that comes after a hysterectomy. As a pelvic floor physiotherapist, I literally see so many women who just feel totally lost in this post-surgical chapter. So today, we're going to gently, but clinically, guide you through the actual physical realities of your recovery, and way more importantly, how you can reclaim your body. Let's just dive right in. Okay, if you've been living with pelvic pain and someone has told you it's just normal, or worse, that nothing can be done, I need you to hear this loud and clear. Your pelvic pain is real. It is absolutely not in your head. And yes, there are evidence-based treatments that actually work. So many women spend years feeling dismissed, and I just want to deeply validate your experience, right here, right now. You deserve specialist care, period. Now, the crucial thing we have to distinguish here is the difference between normal healing and chronic dysfunction. Obviously, recovering from major surgery involves some short-term discomfort, that's a given. But living with chronic pain, that heavy pelvic pressure, or bladder leaks months down the line, that is a blaring signal that your pelvic floor is craving dedicated support. It's definitely not something you just have to put up with because you're a woman. Section 1. The reality of hysterectomy. Let's start by looking at what exactly a hysterectomy does physically and why your body probably feels so incredibly different now. So it's the surgical removal of the uterus and sometimes the cervix or other reproductive organs too. And whether you had this done for endometriosis, fibroids, abnormal bleeding, or persistent pain, it was likely a super necessary, maybe even life-saving step. But taking out the uterus profoundly alters the structural support system and the entire ecosystem of your pelvis. Because of this massive structural shift, you might be dealing with one or maybe several of these symptoms. Things like urinary incontinence, pelvic organ prolapse, persistent pain, or even changes in intimacy and sexual function. I cannot stress this enough. These are incredibly common physical reactions to this surgery. You aren't broken, and you are definitely not alone in experiencing this. Section 2. Changes in your pelvis. To really wrap our heads around why these symptoms pop up, we've got to look at the mechanics of your body post-surgery. Before your operation, your uterus, your ligaments, and fascia naturally distributed all that intra-abdominal pressure. But removing the uterus? It leaves a literal physical void. So your remaining organs, ligaments, and pelvic floor muscles are suddenly forced to shift and bear weight in entirely new ways. They literally have to adapt to totally new structural forces. And that, of course, can easily trigger tension, weakness, and all those symptoms we just went over. On top of those structural shifts, we absolutely have to talk about scar tissue. As you heal, the scar tissue forming inside your pelvis can end up acting kind of like a tight, restrictive web. It can pull on those super sensitive pelvic nerves, restrict your natural tissue mobility, and really heavily contribute to bladder urgency or pain during sex. Basically, it completely changes the way your tissues are supposed to glide and stretch. Section 3. Physiotherapy. The missing piece. Well, the really good news here is that your pelvic floor is highly, highly adaptable, and this is exactly where specialized physiotherapy swoops in to bridge the gap in your recovery. But you're probably wondering, what actually happens in a pelvic floor physio session? And how on earth does that translate to real, tangible relief from those annoying daily symptoms? So at specialist clinics, we take a completely personalized, comprehensive approach. First, we sit down for a really thorough review of your surgical history. We genuinely listen to your whole story. Then we do a gentle, totally unhurried assessment of your posture, your breathing mechanics, and your tissue mobility. The whole treatment is absolutely tailored to your comfort and consent. We usually utilize some manual therapy and scar mobilization before we gently progress into personalized strengthening and relaxation exercises. As you can see, our care is extremely targeted. We don't just treat generalized pain. We use super specific, evidence-based techniques to go after the exact mechanism causing your issue. Dealing with urinary incontinence, we're going to do bladder retraining. Experiencing sexual discomfort, we'll focus on improving tissue mobility and releasing that built-up muscle tension. We literally meet your body exactly where it's at right now to restore your function. Section 4. Your road to recovery. Okay, stay with me here because this next part is absolutely crucial, especially if you feel like you've been suffering for way too long. A massive worry I hear all the time is, did I miss my window for healing?
So let's look at a realistic timeline. Most women can start gentle rehab around 6 to 8 weeks post-surgery, focusing on breathing and mobility. By 12 weeks, once we get clearance, we can safely do a consent-based internal assessment. But look at that last point, years later. Whether you are a few weeks out or your hysterectomy was literally a decade ago, your body still has this incredible capacity to respond to specialized treatment.
I really want you to let this sink in. It is never too late to improve your pelvic health. Seriously, your muscles and your nervous system can be retrained at literally any stage of life. You absolutely do not have to just settle for a diminished quality of life because some time has passed since your operation.
Section 5. Why choose OVA Clinic? So when you're finally ready to seek help, finding a clinic that actually specializes in complex post-surgical cases is absolutely vital. You need care that goes way beyond standard general physio. And at OVA Women's Health in Burnaby, BC, our physiotherapists specialize in exactly this. We've successfully treated thousands of complex pelvic health cases, which makes us a truly trusted name in post-surgical rehab across the Lower Mainland. We understand the very specific nuances of a pelvis that has been through surgery. We know recovery is never one size fits all. And honestly, that's the OVA difference. We provide highly individualized pacing, we look at your whole body with multidisciplinary awareness, and we create a safe, deeply validating environment where your pain is taken seriously from minute one. And because we know how urgent it can be when you're in pain, we offer extended hours, plus priority and emergency appointments so you can get access fast. Listen, you have been patient long enough. Real specialist help exists. And it all starts with one simple, totally unhurried, and completely confidential appointment. I really encourage you to just pause this explainer right now, grab your phone, and scan the QR code on your screen to book a personalized consultation with our team at OVA Women's Health.
I'm going to leave you with this one final thought. If your pain is real, and we absolutely know that it is, and if the evidence-based treatment exists to actually fix it, isn't it time you finally took that first step to reclaim your body? You completely deserve to feel comfortable, strong, and confident in your pelvis again, and we're right here to help you get there. Thank you so much for joining me for this explainer, and we really hope to see you in the clinic soon.